Sure. So, hi everyone. We can go back to that first slide, Kathy.
You got it.
Um, mhm. So everyone, my name is Melody, and I'm delighted to represent the medical laboratory scientist career on behalf of the Johns Hopkins Hospital. It's Lab Week for us, so we are celebrating our medical laboratory professionals week. So we thought it was a great time to highlight the career and maybe how others can join us. So if you're like me, you may not have heard about the lab as a profession growing up, and I'll tell you a little bit of my story growing up. For now, if you look us up online, we have historically gone through a few different titles. Once upon a time, we were medical technologists, but then technology advanced and then we needed to differentiate ourselves. We became clinical laboratory scientists. And in the past decade, we have been retitled medical laboratory scientists. So these are three long yet essential words that do very well in describing our behind the scenes detective role in patient care. So we complete lab tests to assist the clinical care team with screening, diagnosis, monitoring, and treatment information. Next slide. So in other words, the lab's job is to generate accurate results that provide information in detecting cancer, heart attacks, diabetes, infectious diseases, drugs of abuse, the list goes on and on. In fact, there are several studies that estimate about 60 to 80% of decisions for patients are based on the lab results. And that makes sense, right? So we go to the doctor to get our yearly checkups and we get our blood drawn, it goes to the lab, and then the results confirm we're okay, we're not, maybe we need more testing. I have a bit of a more personal story. A couple years ago, I had a fever that was lasting more than a few days, which could indicate infection, but it could indicate some other underlying issues. So I was feeling awful, went to the doctor, and they tested me for strep, flu, and COVID. And we were all convinced it was strep throat because of my excruciatingly painful sore throat. But guess what? It wasn't that. I had COVID and flu. So that information changed my treatment plan from antibiotics to antivirals, and I did eventually get better. But we wouldn't have known this without the lab. So as you can see on the screen here, the lab has several different specialties. First and foremost, we have phlebotomy. We wouldn't be able to have our blood samples if it wasn't for our incredible team of phlebotomists that go and meet with patients and draw their blood. Those programs typically just will train you in a couple months or so for certificates. If you're on the analytical side, which we're highlighting today, you'll see more different departments show up. So hematology at the top, we look at red and white blood cells under microscopes. We've got body fluids, top right-hand corner. We can look at cells and analytes in urine, pleural fluid, synovial, lots of different body sites. We've got clinical chemistry for hormones, electrolytes, tumor markers, cholesterol, and so much more. Got transfusion medicine, which has more blood types to think about besides the ABO that we're all might be more familiar with. They're involved with trauma, operations, sickle cell patients, so much more. We've got molecular biology, so they're expanding their test panels every day as we go towards more personalized medicine. And then microbiology, fan favorite, right? So we get to figure out what bacteria, virus, parasite, or fungi is ailing our patients. Next slide. All right, we'll skip one more. So how did I get here? It's all thanks to this jar of peanut butter that caught my attention years ago. So back when I was in high school, I was essentially directed to one of two healthcare professions. It was be a nurse, become a doctor. So my senior year of high school, I started exploring my pre-med options at my local college campus. I went on tour of their science building, got to see biology, chemistry, physics, the classics. And then on one of those stops, we got to see the medical laboratory sciences department, and I had never heard of it in my life. So the program director, she sets out this peanut butter jar out for us and reminded us about the recent, at the time, peanut butter outbreak in late 2008, early 2009. So in that point of time, there was a salmonella contamination that resulted in over 700 people getting very sick with food poisoning and 9 people had died. It was one of the largest recalls in US history and spanned across 46 states. It was huge. So she asked her tour group, How did the doctors know that the patients had food poisoning? Who completed all those tests? Who provided the data for public health officials to find the source of the outbreak? Who was looking through microscopes and petri dishes and identifying the salmonella? Of course, it was the lab. So that got my attention, and after looking into it, I was sold. Besides being overall fascinating, job security was high, and the coursework matched up to pre-med requirements, so it was a good major that would prepare me for medical school, which was my plan at the time. It made so much sense because if you wanted to take a gap year between college and medical school or grad school, you were basically guaranteed to find a job in healthcare and start collecting relevant patient care experience. So what's not to love? We can go to the next slide and we'll click on the one button. Yes. So here's my timeline. I followed a traditional classic route. So I did a 4-year bachelor's degree in medical laboratory sciences. And I completed my internship over here in Maryland at the Johns Hopkins Hospital. It was like 3 months of rotations. Graduated. Then I took my board exams to become a certified MLS. From there, I started my first job in flow cytometry, my first love, cancer diagnostics. I worked there for 5 years, and since then I've been working in education. There are a few more routes to get into this medical lab career. So this next one is starting off with an associate's degree. So there are 2-year associates called medical laboratory technician programs, which follow the same pattern. You do the coursework, internship, take your exams, and guess what? You get to start working, which is a win. And while you're doing that, you can find in-person or online or hybrid programs that allow you to complete the last 2 years to wrap up and become a bachelor level medical laboratory scientist. Next one click. Yes. It's also possible to discover the lab career after finishing your biology, chemistry, biomedical degree. So in that case, there are programs out there that are finding 1-year certificate programs. So that helps to expedite things. It sometimes seems overwhelming to go back to school for another 2-4 years. These certificate programs are 1 year to condense the material for one category. So maybe hematology or microbiology, blood bank's an option, chemistry. From that point, you complete the coursework, take your internship, and then you qualify to take the board exam and work in that specialized area that you found. And then finally, it is possible to complete military lab training, and then you apply your work experience, and from there you can take the exam and start working in the clinical labs. So the good news is that through 2031, all projections and signs are saying that there will be continued job security for this laboratory field. There is increased demand. We have 3 top reasons. Number 1, we have a large portion of our workforce that is retiring and leaving behind open positions. There's also increase in lab testing, so we're getting more advanced, so more genetic and molecular testing is needed. And then finally, our population is getting old, so they require more screening and monitoring of chronic illnesses like diabetes or cancer. So there is a lot to do. All right, Lorraine.
All right, so I'm going to take over. So some people may think, okay, I stop at a bachelor's, that's as far as I can go in this laboratory field. And that is just not true. But once you get past that bachelor's, the roadmap is really any way you want to take it. So my pathway didn't necessarily go down all of these routes, but these are some of the common things that you can do that are specific for the medical laboratory scientist. So the first thing we can start off is specialty certifications. So sometimes as an MLT or MLS, you decide, I want to be a generalist. I want to work a little bit in all the areas. And that usually works really well at very small, very rural hospitals. But in more urban areas, with very large hospitals, very specialized patient care being needed, you need to have people that are specialized in specific disciplines. So we have what are specialist certifications. And so these are where you are an expert in that field. So here at Johns Hopkins, we actually have a specialist in blood banking program, which I am an SBB myself, and I do run that program. But our graduates from this go on to be technical specialists, supervisors, managers, directors. So you can do a lot with just a specialist certification. And so they have them in many different areas in chemistry, flow cytometry, hematology, microbiology, and molecular biology. Next, click. So say you don't necessarily want to go the specialist route. Well, maybe you want to go more of regulatory or management. Well, we do have masters in MLS that's very specific to the laboratory science that just takes you to the next level. So it helps you go into potential academia if you want to do some teaching. There's masters in other categories that you could take as well. So like I have a master's in education that could teach me to help teaching. Research and development, you can go work for different companies to develop the laboratory testing we're doing in the hospital or in reference labs. They got to start somewhere, right? Develop our instrumentation. Lots of really great things you can do with that MS and MLS. Next, click. And then lastly, we do have a doctorate degree that is specific for medical laboratory scientists. And how Melody mentioned how we used to be called clinical laboratory scientists, medical technologists. Well, that's where the DCLS comes from. So it's basically a doctorate of clinical laboratory science. The important thing with this one is you have to be an MLS to be able to get a DCLS. That is a requirement, all right? So it's very focused for our specific niche of pathology. And they can be laboratory directors. They can go out and consult with the care team for individuals so that they know what tests to order, what to do next. They can do appropriate blood management with these patients. And so really a lot of consultation and kind of really impacting that patient care. Next slide. So here is just everywhere you could possibly go. So once you have the BS and MLS, you can go on, and some of these can be based on those specific requirements that are specific for MLS, or you can go beyond that. And so you can go and stay working in the hospital medical laboratories. You can go into reference laboratories. So specifically, we have immunohematology reference laboratories for the blood bank. So those are research laboratories. They're kind of doing these specialized testing. We have them, if you've ever heard of Quest or LabCorp, they have these reference labs. So you can go in and work there if you don't necessarily want to work in a hospital setting for your entire career. You can go on to academic institutions and teach. So that is something. And also you can become trainers at businesses. So like those companies where they're training people to develop these kind of instrumentations, you could go and be a trainer there. You can also go into information technology. We use a lot of computer systems and a lot of things that work together. So you can have those things together. You can do humanitarian efforts. We have people that are MLS that go on those Mercy ships that go out, and they have to have laboratory testing as well. I mentioned industry, developing those instrumentations, that information technology. You can also go into forensics. I may be dating myself, but when I was in MLS school, CSI, the original, just came out. And it was all about, highlighted the laboratory, and it was just amazing for forensics and how you can actually identify who did it, or we can't identify our patients that we might find or victims, and we can use some forensics to be able to figure that out. We also have professional services. You can work in accreditation bodies. So we have a lot of requirements legally saying we have to do certain things. And the way we keep ourselves honest to make sure we're doing those things is to have accrediting organizations come out and inspect this. We actually just got our assessment last week and we passed. So yay for us. But they come out and they look at all of our processes, our procedures, just to make sure we are doing what we say we are doing and sending out quality results. You can also go into research. So research is an area, what's up and coming? What new diseases might be out there? So COVID, for example, that didn't exist up until, the end of 2019. And so they had to come up with laboratory tests to detect it. And then also the vaccine technology that kind of came in, and that came in very quickly. I was introduced to this with the HIV kind of discovery in the 1980s. And that's still something that's in the back of my head as a blood banker because it really, really affected us, even though I was only in elementary school at the time. I do remember that. Then that leads into public health. So again, COVID, flu, the measles right now, right? All of these things you can get involved with, not only with trying to tracking epidemiology, you can work for the public health services, tracking those things, educating them, following those things. recommending screenings. So we screen every newborn for sickle cell disease. That was not always the case. And they can have a very difficult course for their entire life. And so diagnosing them at birth is also important. And lastly is healthcare administration. So it is really nice when you have people running your facilities that know what it's like to be a healthcare provider. So at Johns Hopkins Hospital, our president, she used to be an anesthesiologist, right? So that is really, really helpful to be able to have that perspective of healthcare as your base, and then get the education and the experience to be able to manage in like finance, safety, leadership, all those types of things as you kind of go up through that you could even go and be a president of a health system. All right, next slide. And so now with every job, there's good things and there's bad things. And some people do better as an MLS than other people might. And so the pros, every day I come to work, I feel like I am making a difference. So to me, it is truly rewarding. I feel every day, everything that I do is helping somebody in the end. Also, as Melody mentioned, job security. I had my job lined up 3 months before I graduated. And I've never been without a job. So sometimes you might have to move places or whatever, but there are jobs out there across the country and we're always in need. Diversity, man, the amount of people that I've met in my life and my career working in this field has been immense. We have people from the Philippines, people from all sorts of different countries here, also different areas of the country that bring all their culture together. Yesterday for Lab Week, we had Sandwich Day, and I decided as a Pennsylvania Dutch person, I'm bringing Lebanon bologna to share with my coworkers. So it's really great to be able to share that. And as I mentioned before, the growth opportunities, they're not as obvious sometimes as, say, like nursing and being a doctor. Those career paths are pretty much spelled out and most people know them. They're still there for us and we can search them out. It's just based on what our interest is at that time. So great opportunities, pros there. The cons, we don't get as much patient contact. Now, I consider that a pro, but it may be a con. So I am more of an introverted person. I know it's surprising, right? So I don't necessarily want to interact with people every day because I find it draining for myself. So here I can help people without going there and seeing them. Like it's very emotional for me to see somebody who's sick, somebody who might be dying. Like it's very draining. But for those that do that, like nurses, our phlebotomists are really great, our doctors, they have that patient contact, that they have that patient interaction, and they thrive with that. If you don't, the lab might be a better place for you. Also, the one thing that you're all here for, probably never heard of this profession before, we don't get a lot of recognition because we don't have the patient contact. People don't know who we are or really what we do. They think we are drawing the blood, which our phlebotomists do an amazing job. I don't have that kind of talent. They do an amazing job, but that's all they see and that's all they think that we do. Well, we're really solving problems. For example, in the blood bank, I can identify somebody as a blood type. I can also figure if they have antibodies to other red cell antigens, which may make it very dangerous for them to get blood products. And then we have to find the safe blood products for them to provide it to them so they can get their medical care. So even though I'm not being recognized by the public, we definitely recognize ourselves as the role that we play in healthcare. Next slide. So we have some additional resources, and so I'll copy these and put these down into the chat section. But we do have a careers page for Johns Hopkins Pathology that kind of lists all the careers. We're only highlighting a couple here today, but there's a whole bunch out there so that you can see. And then we've linked the schools that have these programs that we host students from so that they can come on their internships here at Johns Hopkins Hospital or Johns Hopkins Medicine at our other facilities. So we enjoy having students every year. Also, the ASCLS has some really good information about the medical laboratory science field. So ASCLS is the American Society for Clinical Laboratory Science. So it's just for us in the laboratory. And they have some great opportunities there if you want to check it out. Next slide. All right, now I'm going to pass it over to my colleague, Yulanda. Take it away.
Hello, everyone. I'm Yulanda Mitchell, and I'm going to be talking a little bit about anatomic pathology. You've heard a lot about our clinical side. A lot of things do cross over. So I'll try not to be redundant, but do share with you some of the differences. in our area of anatomic pathology. Histology is my background, so I'll focus a little bit more on that, but I'll touch on some of the other areas. Again, we have a variety of things that we can do here. Histotechnology is the study of tissues. Part of the field of pathology is the study of disease. And we take the tissues, if you think of a biopsy, possibly that where there needs to be an extraction, there may be surgery. They would take that and bring those tissues to the growth room. It is then the job of the PA or the resident to gross or to dissect the tissue. There are various things they'll be looking for. It may be marked in various ways to show the area of concern. After which that has been done, it is prepared to go to the histology lab, which is where we do our processing. The tissue would be put in formalin. You want to stop it from breaking down, any autolysis, putrefaction. And then we want to begin to prepare it to be cut. Microtomy is what and how we make the slides. And so it's a very interesting process of what we do to look for those abnormalities of disease that the doctor will be able to look at, possibly by way of slide, may need special staining. We do and are able to do the staining that would, again, expose the area of interest. And so we have a lot of different things we do, but before I go into that, let me, next slide, please. Yeah, I talked about the process, and here is an example of that where you have fixation. Tissue could be in maybe a saline solution, usually if it's in a small tube like that. But ultimately, we would want to get it to formalin so that it could be fixed and ultimately cut, stained, and archived in a way that we can retrieve. We're really happy here at Hopkins. We are really moving forward with our ability to archive. We have a digital pathology area that we now are able to move slides digitally and not necessarily glass the way we used to. So we're really embarking upon the future in terms of diagnosis. Next slide, please. So how did I get here? When you're young, there are so many things that you probably desire to do, but you really don't know where you'll end up. I was a student at Dunbar Senior High School, and we, had a program, health professions program, which I was a part of for most of my high school, 10th grade, 11th through 12th grade years. And so I spent an extensive amount of time up here at Johns Hopkins. They really made an investment into my future in a way I just didn't expect. And so I think it's just so important that we continue that legacy of bringing students here to share with them what they can do, what possibilities await for them in terms of what we do every day. And so I would come here and still never knew I would work at Johns Hopkins, but I had gone to school and I, wasn't quite sure what I wanted to do. I thought I was going to be a pharmacist. However, that was something I just didn't find as interesting. And while I was working at University of Maryland in the pharmacy department, I started sharing some of my desires with the pharmacist, who then called over to the medical examiner's office. And she said, hey, I have a student here who's really interested in pathology. She loves biology. And they said, send her over. And at the time, it was right next door to University of Maryland side. I went over and I would participate with the autopsies as a volunteer. And this old guy, he was a little short, really strong gentleman, and he was probably in his 50s. He came over to me and he said, young lady, these bodies are a little too heavy for you. I think you should go to histology. That's kind of how I found out about histology. He walked me to the laboratory and I was able to see all of the tissue that we had just cut out of the body, and we had taken them to the histology lab, and that's kind of how I got my start. But it again, never seems to amaze me how we end up right where we're needing to be. Sometimes we don't know how it is we're going to get there, and we don't necessarily, as much as we try to map it out, we just end up in a great place. So I have certainly been in this field for about 25 years. 26 years, and I love it. And I try to share with all of our young people just how great this area of pathology is. Next slide. So we have several different pathways to get to where you want to be in anatomic pathology. We have, the gross room surgical pathology. Anatomic pathology consists of surgical pathology here at Johns Hopkins. Surgical pathology consists of the gross room and the histology lab. And so if you are one who are considering the field, maybe you don't have the education, there are entry-level positions where you are able to come into this field. Our sessioner is one of those entry-level positions. We also have our prep techs. We have the histoprep techs. We have the cytoprep techs, where you can come into the laboratory and kind of, be groomed learning from the beginning stage, so that you will be able to ultimately decide if you want to go to school for something specific you can for certification. We also have in the gross room tech. It used to be our PA1 position. We took that away, and that's now the gross room tech position. It's a position where you don't have to have a degree, but you should have at least some biology and some chemistry, maybe some science as your background. We also in the gross room have pathologist assistants. Pathologist assistant ones still reside there, and pathologist assistant twos. They are those who have their master's degree, moving through a PA school. We know the University of Maryland is one here that many of our pathologist assistants have gone through. But there's many throughout the country if you're interested in moving and becoming a PA. And then also there's our lead PA as well as management. In histology, kind of sort of the same route, a little different in terms of histoprep tech. That's the person who prepares and would be the one preparing the work for the histotechnologist or the histotechnician. Again, that's an entry-level position that we could, train you up. So after a year or 2 years, you'll be eligible to move into the histology 1 position. As a histologist, that we do require in some instances for a histotech 2 position, and maybe there's some schooling. Also, that certification is something that you've achieved at that point. There is a program that we have with CCBC where you're able to move through a 2-year program. It's not even 2 years, it's about 1.5 years technically. And you would be eligible to take your test for certification for histotechnician. If you are or have a bachelor's degree, you will be eligible to be certified as a histotechnologist in this area. And so we also have lead histotechs as well. Other entry-level positions, archivist position, where you'll be able to archive blocks and slides. Consult coordinator is another entry-level position, but again, it places you in the field so that you will begin to learn some of our systems here. Pathology send-out office is another area which you could work your way up as an entry-level position, and medical records coordinator. And so there are many paths. And when you look at the salary ranges, we know that ASCP can only give us a range, but in some respects, some of those ranges are moving. And we're really grateful to see what our lab or what our abilities are in this field. And so there is growth here and potential to earn more income as well. And so histotechnologist, somewhere can make somewhere between 67,000 and through 85,000. But again, that range is moving. It just depends on the job in the hospital, the state, where you work. And as well, we have management who are, somewhere between that 98,000 to 140,000 K. Again, that is depending on the responsibility level of the individual, and also a PA. The PA again works hand in hand with our pathologist, and they're training our residents And so they're somewhere between that 188,000 and 124,000. Next slide, please. And so anatomic pathology, again, if you choose that area as a career path, again, those as well, with the exception of cytology, autopsy is PAs that work in that field, autopsy technicians, immunofluorescence labs that we have, electron microscopy, they're histotechs that work in that area. So they would as well be able to assume those prep tech positions. But our cytologists, the study of cells, they as well work along with us in anatomic pathology, and they have cytoprep tech positions. Again, if you would like to work your way up, you can do that. Our cytologists now are required to have a master's degree, and you would have to do that in order to be able to set for the test for a cytologist. And so, again, the range is kind of the same, a little different. But the cytotechnologist is kind of between at 80,000, 96,000. And of course, we have management directors in all of the areas, just like clinical does. And that could be a various range. And so we have a lot of different ways that you can move through here at Johns Hopkins if you're interested in pursuing any type of anatomic pathology or surgical pathology. There are many ways to get to your goal, and we're always open and welcoming anyone who would like to come and do a tour or spend some time in these areas. Next.